Good afternoon, everyone, and welcome back for the final two sessions of the day. I'll go and find my seat. Right, I hope you enjoyed your lunch. I hope you enjoyed the breakout sessions and the networking. Our next guest, I think you all know, is going to be the Shadow Secretary of State for Health, Wes Streeting. He's joining us to discuss what he sees as the priorities for the NHS. We've been talking about the fact that the next general election is a year or so away at most. Just to note that this session will be live streamed and we'll be taking questions from the audience. You can contribute online or you can contribute in the room. There's a slide with the Q&A function and you can use the QR code. Just pick the right session to put your question in. Right, without further ado, I'll welcome Wes Streeting.
Thanks, Samira, and thanks to all of you for inviting me to be here to speak to you today. I hope everyone's enjoyed the latest merry-go-round of the Conservative Clown Show in Westminster this week. I gather this morning you heard from Victoria Atkins, who is now the 5th Secretary of State for Health and Social Care I've faced since being appointed as Shadow Health Secretary less than 2 years ago. Although, to be fair, two of them were called Steve Barclay. I understand she told you in her message that she is looking forward to working with you in the weeks and months ahead. At least she's realistic. In contrast to the chopping and changing you have become used to from the government today, I want to give you a clear idea of how a Labour government will work with you over 5 years to get the NHS back on its feet. That's right. I gather Keir's not planning to make any changes, so like it or lump it, you are stuck with me, I hope, for the foreseeable future. There are two great domestic crises facing our country today: the cost of living crisis and the crisis in our NHS, the worst in its history. And of course, each crisis reinforces the other. The state of the economy, the public finances, and the squeeze on people's personal finances will make it harder to escape the crisis in the NHS. The consequence of 13 years of low growth in our economy is that we have the highest tax burden on working people since the 1950s. Working people literally cannot afford it to go higher. And the consequence of the economic joyride that the Conservatives took last year is that there is no slack in the public finances. So there's no route out of the crisis in the NHS that requires simply spending more money. That's the context in which we meet today. And if my party are privileged enough to win the next election and form the next government, that is the reality we will inherit. The status quo in the health service is intolerable to me, to you, and most of all to the patients we serve. The crisis too urgent for us to simply wait for the economy to pick up. There isn't time to wait. Not for the millions of people whose lives are put on hold while they wait for care, not for those with conditions slowly worsening while they wait to see a GP, a specialist, or for a scan, not for those who will need to call for an ambulance this winter. So it really is reform or die, not a slogan, but a reality. The NHS must change, and in a year's time, it will fall to us in this room to change it. I know the reform argument that Keir and I have been making hasn't always been a crowd pleaser. On BBC Question Time earlier this year, a panellist told me that reform, the word reform, goes down like a cup of cold sick. Well, I'm afraid it's worse than they thought. We really do believe this stuff. And not only because of the scale of the crisis you all face today, not only because as waits rise, public confidence in the health service falls, but because the challenges coming down the track of rising chronic disease, our ageing society, these challenges are even bigger than we face today. They threaten to overwhelm and even bankrupt the NHS. The Department of Health and Social Care today accounts for 42% of total departmental spending. IFS analysis of the NHS workforce plan suggests that half of the public sector will be employed by the NHS by 2036. Now, I like Amanda Pritchard very much, but we're in danger of making her Louis XIV, l'état c'est moi. The costs of continuing with the status quo, simply pouring ever-increasing amounts of money into a broken system, will ultimately be borne by our schools, our pensioners, our police, and in this dangerous world, by our nation's capacity to defend itself. This is not acceptable to Labour, and I know it is not acceptable to you. You see the consequences of poverty and a broken public realm walk through the doors of your hospitals and trusts every day. You know that without a healthy economy, without good public services, we cannot build a healthy society. The NHS, therefore, has a duty to get better value for taxpayers' money. The government's announcement last week sums up their failure over the past 13 years. At the same time as another short-term pot of funding, they watered down targets for operations and appointments this year. Not only have they waved the white flag on Rishi Sunak's pledge to cut waiting lists, they have once again left the public literally paying more and getting less. And it's not just the cost of their failure to resolve the strikes for the past 11 months either. It's the £3 billion a year paid to recruitment agencies. It's the estimated £1.7 billion cost of delayed discharges and the 13,000 beds, enough to fill 26 hospitals, taken up each day by patients who do not need to be there. The costs of failure are racking up, and while the taxpayer is picking up the bill, the heaviest price is paid by patients. The NHS has got to work better for patients and taxpayers. It's the only way we're going to turn this crisis around, by getting more out for what we put in. So if Labour wins the next election, and we're back in this room in a year's time, that's what we will have to achieve from our relationship together. And that's what I want to talk to you about today. So that's where the doom and gloom ends, because if I am back here in a year's time as Secretary of State for Health and Social Care, it will be with a very clear task. The targets Keir and I have committed to meeting within 5 years, elective treatment within 18 weeks, waits in A&E of no more than 4 hours, ambulances that arrive on time, GP appointments when you need one, and NHS back on its feet, there for you when you need it. And over 10 years, even greater ambition, fewer lives lost to the biggest killers, cancer, heart disease, stroke and suicide. The gap in healthy life expectancy between regions halved, so everyone lives well for longer, and NHS fit for the future. I know how far off we are today. I recognise that it feels almost impossible, but it isn't. You have done this before, and we can do it again. This may come as a shock to some of you, but I don't have a messiah complex. I know that the NHS will not be turned around by one person in the Department of Health. When Keir says that our mission is to get the NHS back on its feet and fit for the future, he's not just talking about the shadow cabinet. If we're going to do this, it will have to be the mission of Keir, of me, of everyone in this room, and your 1.3 million colleagues outside of it. A mission across government, a mission in partnership with business and civil society, and a mission that involves patients too. If we're going to deliver the care that patients deserve, we will only be able to do it together. So today I'm promising a deal. My promise to you is this: I will end the micromanaging. No more getting on the phone to you about whatever issue pops into the Secretary of State's head on any given day. Every day you spend rewriting the job titles for your equality, diversity and inclusion officers is a day you're not 100% focused on bringing down waiting times for patients. I won't waste your time or mine. There is no time to waste. Instead, we will give you long-term certainty with clear priorities over a 5 and 10-year period, as already set out in Labour's mission. By setting them now, we have bound my hands and I hope liberated yours. This must be our focus every day over 5 years. You will be given the freedom to innovate, to try new things, and to find the best ways of getting the service working better for patients. In return, we need much more transparency so we can see what's working and what's not. Where it's working, we will encourage you to go further, faster. Where it's not, we will get the support in place to turn around your provider as quickly as possible. A new culture based on honesty between grown-ups and a shared mission to get the NHS back on its feet and fit for the future. I know that given the freedoms and the right incentives, you will deliver. And what gives me that confidence are the people working with and for the NHS today, leading that way to the better future we want. They, you, are showing that things can get better. Out of the chaos of the pandemic and the unbearable pressures facing the service today, with their backs against the wall, great NHS leaders are coming up with brilliant solutions, like the Sussex Musculoskeletal Partnership, who hired a local leisure centre and invited their entire waiting list. Patients could speak with clinicians, be directed to community support groups and charities that were present, across wider health and wellbeing services too, and get immediate rehabilitation treatment, all in under 2 hours. People were saved months of being passed from pillar to post, service to service. 550 people attended over 2 days, half of whom were then discharged from the waiting list. Patients who didn't attend were seen 5 weeks sooner because the waiting list had been cut so significantly as a result. And Labour's plan to cut waiting lists wasn't dreamt up by me or my team. It came from a number of trusts around the country. They've set up specialist clinics on weekends, shared waiting lists and staff across neighbouring hospitals, and dramatically reduced waits for patients. We will put £1.1 billion behind this idea, paid for by abolishing the non-dom tax status, so patients in every corner of the country benefit. That will be my role in this new relationship, not top-down reorganisations and more structural changes from above, taking the extraordinary things already happening in the health service and making them the ordinary, bringing the best of the NHS to the rest of the NHS. The centre will always have a role in giving the NHS the tools it needs to do the job, whether it's training thousands more staff, doubling the number of scanners, bulk buying the latest technology and getting it to you faster, cutting red tape so GPs can provide continuity of care, a fair pay agreement for care workers, mental health support and toothbrushing in schools to prevent ill health in the first place. Labour will arm you to the teeth to turn this around. The reforms themselves will have to come from you. We're not just going to ask you to deliver, but to lead on changing the system, to provide healthcare in new, different ways, form partnerships with each other, the private and the voluntary sector, and embrace new methods of treatment and prevention. That means taking the lead on shifting the focus of healthcare out of hospital and into the community, ditching the old ways of working to bring the NHS into the digital age, and reducing demand with more of a focus on preventing ill health as opposed to simply treating it. Again, some of the best leaders have already blazed this trail. At this conference last year, I spoke about Leeds and Mid-Cheshire Trusts, which have shared their budgets with local authorities to boost social care and cut delayed discharges. That collaboration keeps patients out of hospital, helps their recovery, and frees up hospital beds for those who need them. Better for patients, less expensive for the taxpayer. But it shouldn't take 400,000 delayed discharges a month and A&E waiting times going through the roof. Change can't wait for the interests of the organisation to align with those of patients. We need a permanent revolution in the NHS so it is constantly improving for patients. That greater freedom I describe can't mean less accountability, so that's the deal. Clearer direction, but less interference from above, with more transparency and accountability in return. People today watch drivers delivering their takeaways on virtual maps in real time. They choose what film to watch and product to buy based on the reviews of thousands of their peers, and they have a lifetime of information available to them at the touch of a button. If they want to know how long it will take to get the scan or operation they need or to see their GP, they can easily find that out too, so long as they have private healthcare or they are prepared to trawl through complicated data sets. People want this information, and it should be available to everyone, not just the wealthy, well-informed. The NHS will always be the public's service, there to serve the public. Patients' interests must always be at its heart, and the public should be able to judge if it is doing a good job by them. If it isn't, it is right that patients should have the choice to go elsewhere. So we will make sure that people can see how their local providers are performing and the progress being made towards our targets. This new age of transparency will empower patients and put their experience at the centre of the service. With Labour, you won't just be told how well your trust is doing, you'll also be told how well they should be doing with information about what the national standards are and what best practice looks like. But we also need greater transparency so that we can spot what is working and who to learn from. For those services at the top of the league tables, we need to make sure they don't hit a ceiling. They should be incentivized to put the foot down on the accelerator and continue improving. For those at the bottom of the table, they need identifying so we can get them the support needed to get back on track. We will partner them with turnaround teams of the best leaders to support them and monitor performance data more closely. The number of patients waiting 52 weeks fell by a few percent nationally in the past year, and that reduction was brought about by the improved work of less than a third of ICSs who have reduced the longest waits. Clearly, they do not need the same level of performance management or support as others. We will need very different approaches for different organisations. The number of delayed discharges are marginally down this year, but in 16 integrated care systems they have worsened, and in some, twice as many patients are stuck in hospital when they don't need to be there. This may be caused by poor practice, demographics, or local social care capacity. As Secretary of State, I would expect that question to be quickly answered and a plan in place to turn around those worst performing services. The Conservatives have simply looked the other way and tolerated providers falling behind. We will not, we cannot, if we're to get the NHS back to where it needs to be, delivering for patients in every part of the country. Accountability also means recognising the seriousness of the work you do. When you get it right, lives are saved and transformed. When you don't, the consequences can be tragic. This was brought into horrifying clarity most recently by the appalling events at the Countess of Chester Hospital. The case for change has been made repeatedly. In 2017 by Sir Robert Francis, in 2019 by Tom Clark QC, and in 2022 by General Sir Gordon Messenger and Dame Linda Pollard. It is long past time for action. In September, I wrote to Julian and to Matthew Taylor at the NHS Confederation, asking you to begin consulting your members and patient groups. In government, we will work with you to introduce a system of regulation and, crucially, training to promote excellent leadership and to protect patients when things go wrong. I'm clear this must include disbarring those found guilty of serious misconduct. Our aim in all of this is to foster first-rate leadership across the service. That's why today I can announce that we will establish a College of Clinical Leadership. Good clinical leadership is crucial to improve services, quality of care, and transforming healthcare, and it is time that is recognised. That's the deal, the new relationship, the change in culture that we are proposing. The aim? To get the NHS back on its feet and make it fit for the future. How? By getting more out for what we put in, not asking NHS staff to work harder, but helping them to work smarter. The changes will be fundamental and deep. It will take time, and we will support you through the transition. But we believe that the NHS can survive and thrive in the 21st century if we follow this approach. Reform was crucial to the last Labour government, delivering the shortest waiting lists and highest patient satisfaction in history. I don't shy away from that record. It's what gives me confidence that we can turn the crisis in the NHS around. You did it before, and we can do it again. Yes, times have changed. The crisis is, of course, much worse today. The state of the economy, far poorer. But we shouldn't lose sight of the advantages we have today either. There are opportunities available to us that were unimaginable back then. The revolution in data, medical technology, and life sciences are game changers. Nye Bevan, the great founder of the NHS, said the service must always be changing, improving. And throughout its history, the NHS has changed, adapted, pioneered. From the first mass immunisation programme in 1958 to delivering the COVID vaccine that led us out of lockdown and the pandemic. From the first test tube baby in 1978, bringing hope to childless couples, to the introduction of NHS Direct in 1998, making healthcare advice available to all 24/7. Today, it falls to us, our generation, to harness the best innovations, technological advances and breakthroughs in life sciences. And I'm convinced that if we combine the ingenuity of our leading scientists, the innovation of our NHS leaders, and the care of our staff, the NHS can once again be the envy of the world. If I'm back here in a year's time, we will together begin that journey. Thank you very much.
Thank you so much. There's some water if you need. I'm going to ask one question and then I'm going to start taking the terrific questions that are coming in from the audience. You talked about a 5 to 10 year commitment. People will be wondering though, what are you thinking and prioritising in your first year, maybe even in your first 100 days?
Sure, to an extent you can see that with the, well, thanks very much. To an extent you get a sense of that from some of the commitments we made at the Labour Party conference back here in Liverpool actually, in what feels like years ago now, but it's actually only weeks ago. We've got to deal with the elective backlog, we've got to get the waiting list down, that's crucial for patients who are waiting in agony. I think actually it's essential for staff morale too. I think it's vital that in the immediate future that staff begin to feel like they're working in an improving NHS, not a failing NHS. I think that's essential to retention alongside other things. It's also really important for the economy as well. We're not going to get the economic growth we need if people are languishing sick on waiting lists, and that's why we've made some very specific practical commitments. 2 million more appointments a year to cut NHS waiting lists, 700,000 extra NHS dentistry appointments a year. So those things we can sort of crack on with pretty much immediately. But the wider change will take time, and that's why we're committed to a degree of service recovery in the first term of a Labour government, but also being honest with ourselves, with you, and crucially with the public, that if we're serious about building an NHS fit for the future, that's going to be a decade in the making. It took a decade to break the NHS to the point that it is today, and it's going to take time to turn it around. And you certainly wouldn't believe me, I don't think the public would believe me if I said there were quick fixes or a Labour magic wand and just continuity of secretaries of state will turn things around. And in building that plan, we're looking this side of the election very deeply and seriously and practically. So we go into access talks with the department, but out of the other side of the election with a credible set of plans. But I feel very strongly, especially reflecting back on how the last Labour government approached its 10-year plan, that it's got to be firstly a plan for health and social care. And secondly, if we're to bring to life that cultural change that I described, it's got to be a genuine partnership. So what I don't want to do is race straight out of an election and within the first 100 days impose a 10-year plan on the system. I think it's important that I come out the traps with a credible plan for you to get your teeth into, to scrutinise, to challenge, to inform, to iterate, reiterate, and come out with something at the end of that process that's much stronger as a result, that you have genuine buy-in to. And I don't just mean leaders in this room, I mean people working at every level of the system. Because going back to, and I'll finish on this point to get more questions in, going back to something I said in the speech about that episode of Question Time and reform going down like a bucket of cold sick, I've actually been pleasantly surprised and taken aback by the extent to which people working at every level of the NHS and social care system are desperate to see things change and improve. And when I've talked, for example, about improving back office systems and IT to improve the staff interface with systems, their patients' experience and their satisfaction at work, I thought the reaction would be, oh no, not another government IT project. Actually, people are already seeing that working in a number of places and they want a piece of that action. So I think there is an appetite for change. Where the anxiety comes in is people want it to be change they can believe in. Change that they're bought into and change that they can shape at every level of the NHS. So that's the commitment I make in terms of the culture and the approach we will take in building a 10-year plan for health and social care. You just pointed out, obviously, that it's health and social care. You also mentioned in your speech a fair pay agreement for care workers. Several questions have come in about whether you're going to commit to more funding for social care. It's been this issue that's been left over the last 13 years. So we started off with workforce because I think, like the NHS, if you don't have a plan for the workforce, you don't have a plan for the system. Glad we finally got the government to a point where they're beginning that process of the expansion that we need in the NHS workforce. But in social care, unless we deal with fair pay, we're going to still struggle on recruitment and retention. And more than that, I think people who work in social care are care professionals. The idea that they are unskilled workers is an insult to the work that they do and the value that families place in those wonderful people. And we can't keep on exploiting their goodwill. So it'll be first of a series of fair pay agreements across sectors, actually. We'll start with social care. But in building the long-term plan for social care, I'll have more to say about that in the not-too-distant future, because, again, we've got to get the approach right on how we build that plan.
Because, of course, it involves local authorities and their funding picture.
It involves local authorities, it involves a large and diverse private sector, it involves the interface with the NHS, and frankly, there isn't a shortage of good ideas, there's just been a shortage of good politics on social care for more than a decade. And, whether it was David Cameron, back in the news, torpedoing Gordon Brown and Andy Burnham's plan and white paper in 2010, Labour torpedoing Theresa May's plan in 2017, the Tories torpedoing their own plan with Boris Johnson after 2019, you can just see how the party politics has really held back the focus on the long-term future of social care. And so it's my responsibility to fix the politics so that we can get the plan, and I'll have more to say about that in the not-too-distant future.
All right. What's your position on the new hospital programme?
I'm really looking forward to engaging with the new Secretary of State, as no doubt she will go in, and as I would be doing on day one after a general election, and saying, so the new hospital plan, how's it going? What's the timescale? And how's the funding looking? And I hope that she will be able to provide the same assurances that Steve Barclay gave us all, that this plan absolutely stacks up and will be delivered within budget. But I think there are real concerns about the way in which the plan has been set out, the way in which it's held up to scrutiny so far. So we're looking really carefully at not just the new hospitals, but thinking more broadly about the big capital investment challenge across the health and social care estate. I want to make sure that those new hospital projects are delivered. You look at some of those buildings and they're an absolute state. I mean, take Watford General. I mean, we proposed that rebuild when we were last in government. The Tories scrapped the plan when they came in, and then we literally ended up with a sinkhole outside Watford General. I mean, what a epitome of Conservative government, a sinkhole outside the hospital. So we know that there's an urgent, pressing need to do that, and I would prefer this not to be a battle line between Labour and the Conservatives, because when the system and when government sets out a big capital programme, it's really important it's stuck to. I'm afraid we've seen that with HS2, and I don't want to see the same happen to long-term investment plans for the NHS estate.
What's your view on the current plan to reduce routine elective activity and other NHS programmes to fund urgent and emergency services for the winter ahead? And I know that you're not in power, but you must have a view.
I think it's, well, I mean, as I said in my speech, really, for the public, it feels like paying more and getting less, and robbing Peter to pay Paul. And the reason why we end up back in this depressing annual cycle, and it really is an annual cycle now. In fact, it's become a year round. We used to have annual winter crises under the Tories. Now we have a perma crisis. But it is really depressing when, winter isn't a surprise, happens every year, roughly the same time every year, and we know the challenges that it brings. But government is so slow to do proper planning ahead and to put in place the certainty and stability in terms of funding and support to allow people to plan adequately. So we end up in the worst of all worlds, where money is unlocked far too late, thrown at the system to give the impression something's happening. The system do their best to use the resources they're given as best they can, but ultimately it doesn't make the impact it would have had if the planning had been a lot earlier, a lot more predictable and delivered in partnership with the system. So it's kind of why it's referenced in the speech, this kind of the constant merry-go-round of short-term funding pots. It's wasteful in every sense, a waste of money, a waste of time, and a waste of potential. And, the truth is, Victoria Atkins is arriving as the new Secretary of State at roughly the same time that, if there's a general election this time next year, I could arrive in the department as a new Secretary of State should we win the election. And at this stage, there isn't that much you can really do ahead of winter. It's kind of already landing on us. So I'm pretty furious, to be honest, about the waste of money that we see and also the consequences for patients as a result. And that's one of many reasons why Rishi Sunak won't hit his commitment to cut waiting lists.
A question about the reward packages, so pensions really. How will you make sure that the reward package for NHS staff is fit for purpose and helps support capacity? So as an example, the pension scheme, this asks a questioner, says is a fantastic benefit, but underappreciated. For those earning the least, it's unaffordable during the cost of living crisis. For those who are the most senior, pensions tax means that there's a risk of people taking retirement because there's loss of capacity, because they feel there's no alternative reward available. And there is fear that Labour government will reintroduce the lifetime allowance, causing many more immediate retirements.
Well, I think the last fear is unfounded, and bluntly, we wouldn't have got to where we got to with the government had we not banged this drum in Parliament. And I would be very clear about why it was that we made that case, because we recognised that we were losing people from the NHS far earlier than they would have otherwise chosen, because their accountant says that there was no point in them working for the NHS any longer because of the tax arrangements. Mm-hmm. But my kind of only caveat to that is, as a result, that was a fairly generous tax cut for some fairly wealthy people. So we're not going to undo that, and we're not going to put doctors in a position where they're forced to retire early, because it's not in our national interest. But as a result of taking that decision, we don't expect to be beaten up along the way. A simple thank you will do.
Okay. You've mentioned providing support for challenged providers, and you talked about a college of clinical leadership. What will support look like, especially if you've got these league tables where it'll be obvious if people are failing? And we know the experience of league tables in the past under previous Labour government was controversial about the impact they had.
Yeah, I'm glad the question was put in that way. I sort of did wonder, whether people would pick it outside on league tables. I know they're really, really popular. I hope that the way I've sort of set this out this afternoon gives you a real sense of what it is we're trying to achieve and why and how we're trying to achieve it. Because I think there's a pretty blunt approach to performance management, especially where you've got providers that are trailing either the national average or seriously trailing the top performers. And sometimes, with big P and small p politics, organisational politics, there can be a temptation to say, well, this trust is failing, sack the leaders, must be the chief exec's fault. We're going to get a new chief exec in, we're going to get a new chief operating officer in, and that's going to solve the problem. And then they come in and, there's some marginal improvements, and then a few years down the line, CQC comes back and performance isn't very good, and so they say, right, we're going to sack this chief executive and this chief operating officer and get someone. I don't think that's serious, and unless it's demonstrable that the problem genuinely is individual personnel, and I think we should have low tolerance for poor personal performance.
Can I just add a question in there, which is someone said, you have previously had a very dim view of NHS managers. In the spirit of honest and grown-up dialogue, is that still your view? You're saying no?
No, I've never had a particularly dim view of NHS managers. I think I did have a pop at the expansion of the number of six-figure salaries paid in the NHS one Boxing Day, which had the, very early on in my job, which had the consequence of ruining everyone's Boxing Day, including mine, as the social media. It turns out every NHS manager in the country was on Twitter that Boxing Day, and they were in my mentions. Look, I've gone out of my way, especially with the sort of announcement about the College of Clinical Leadership to recognise the importance of good leadership and management, and crucially, and to come back to this point of that I was making about just going around and sacking managers all the time. You've got to support people to become good managers and good leaders. Someone might be an outstanding clinician, doesn't automatically make them a good manager or a good leader. It is a skill in itself, and we owe it to leaders in this system and potential leaders in this system to nurture them, to train them and support them. And that's why I say where you've got poor performance at the bottom of a league table, the right approach is to go in and look at the factors that are driving poor performance and to put in place the right package of support to help them turn that around. Because one of the things I've been struck by, and I think one of the cultural changes I've seen in the NHS in recent years, born out of this crisis, is you walk into a hospital, as I did down in the southwest the other summer, and it was on Steve Barclay's hit list the first time he was Secretary of State. It was one of the troubled trusts he was ringing and berating to brief the media and feel good about himself. And I went into the hospital. The chief exec took me around, gave me a very honest account of the challenges, and most of the answers to the poor performance of that hospital lay in primary care and social care. So just coming in or picking up the phone and shouting at a chief exec, demanding they do better, isn't changing anyone's lives, isn't changing patient experience, it's just demoralising. What you actually need to do is go in and look at the contextual factors for poor performance and say, okay, well, what do we need to change in this context? What support do you need from the centre or from system partners to improve performance to the benefit of patients? And that's what I want to bring. And I think having that transparent data available enables us to have those conversations. And the benefit for patients also is, and I see this happen all the time in the sort of world I now live and work in compared to the world I grew up in. The wealthy, well-connected are really good at working out who the good providers are. In fact, they're very good sometimes at working out who the best individual consultants are and making sure they get access to those people and to those providers. And I want every patient to have access to that information and data transparently so they can also make informed choices, not just the wealthy, well-connected.
But I guess the other side of that is people also want to know that their local hospital will be the best place to go and that they don't need to... It's not about having access to information always. It's about just knowing you can trust your local services to provide the best standard. And that was one of the issues that came out of the previous Labour government.
That's absolutely true.
Giving people information that they then have to go and research and then apply for, apply to that hospital, apply to that school.
Well, but to be honest, people are doing that already. It's just that only some people are doing that already. And of course, we would want it to be the case that every local practice, every local hospital, every local provider is providing an outstanding level of care or has the shortest possible waiting list. But I'm starting with the world as it is, not as I would wish it to be. And I want to make sure that we have transparent information, not data sets that are buried away only for the wealthy, well-connected to access.
Wes Streeting, thank you so much. I think you can understand why I just wanted to get through all the questions being submitted online. Sadly, we're out of time for this session, but I'm sure we'll be speaking to you again in one way or another. Thank you again.
Thanks for having me. Thank you.